How to check class 2 cavities is always patient does not when patient does not have any symptom. Normal X-ray, when you take it, you don't see class 2s. When you take a bite wing, then you generally see a class 2. So they can be a large class 2, they can be a small class 2. Large in the sense deeper or shallower. You don't see a width on a 2D X-ray. So this is a class 2. Most likely this will be a bigger class 2 and there might be a small one. We don't know. We don't know. So this was a bigger one. Patient had come with complaint of pain in this tooth. So on X-ray finding, on X-ray finding, I'll show you. Patient had come with this. So big class 2 on a um, biting X-ray. She has got a orthodontic treatment done before, so teeth are not properly aligned and they are not balanced. So there are multiple joint cavities. This is a cavity. So whenever you take a bite wing, you find more cavities. This is a cavity. There is a small cavity here, but it is not visible in X-ray because X-ray will show only and the cavity is quite big. If I show you the photograph of a patient intraoral, you will see a, a then we opened it uh, here. Okay. So this actually shows a class 2 here. We opened a clinic and there was a big class 2 here. We had to do root canal on this tooth. An incidental finding while doing a root canal was that this next tooth also on another taking an angle showed some early class 2. So that needs to be taken care. So any proximal cavity will be visible only in white wings. White wings. So white wings are very important when you take. I'll show you a 3D scan for this patient where you will see a class 2 on the 8. Now this 3D scan shows this is a class 2. We have done a root canal. On the top, X-ray showing a small class 2 here, but it is not visible from outside. So it's must take a whitening to see any cavity developing in the joints. We don't know because we can't see. Like in this case, we did a root canal, but from another angle, if you see the tooth, it shows decalcification on this area. Whole wall is decalcified. When we took one or two angles, it shows cavity. So most likely this will be an inlay or onlay without root canal, and this is an onlay after root canal. So this is a classic case where both are class twos. One is shallow wide, which is onlay only, and one is deep wide. So this is root canal with onlay. So this is the difference. And in this joint, there are cavities. We don't know what is the size of it. It might be just a filling. It might be onlay without root canal. X-ray shows it's not a big cavity. It can be narrow. It can be wider. We don't know. Like in this case, this is filling. Example, I'll tell you. This is a class 2. Right now, there's some temporary filling done by some doctor. The patient said this high stress come out because the width of the wall cavity is big. The filling is not going to stay unless you clean the cavity completely. And the width of the normally general by general rule, if the width complete 100% width is involved, I place only. It may be root canal only, or it may be filling only filling only. So again, in concise, I'll tell you. This patient, we had an option, given an option to patient that if we can either we place a cap or we place an onlay. Onlay is better because only one wall is gone. We have cleaned this part, done root canal through this part, and we haven't cut the outer enamel. Now, if we do a cap, we will remove this whole white portion of enamel and put a cap. So this much out, this much out, only this much remains, which breaks over a period of 10 years. So onlay is a better choice. First, we are not cutting the outer. Second, on the side, if you see, the onlay margins will be always on the occlusal tooth, one third of a tooth. So whenever there is a water seepage or food getting retained, it retains in this area. So there's hardly any possibility of a secondary caries in onlays. So onlay is always a better choice because you are cutting only the top surface and putting an onlay here. Normally seepage occurs from these areas, not from this area. So secondary caries underneath the onlay is less. So today I explained you the difference between in filling, inlay, onlay. Again in concise, if the if the cavity is shallow, then option is filling. If a cavity is deep, it is root canal. If it is narrow, it is filling. If it is wider, it is onlay. So, so all options are open.